Welcome back to Ask Endocrinologist. I am Dr. Grace. I'm an internal medicine board certified and also an endocrinology fellow. Together with me in this channel is Dr. Hope.
Hi, I'm Dr. Hope. I'm an endocrinology attending. I've been practicing endocrinology for over 20 years, and we are happy to be here with you to tell you more about endocrine diseases.
Yes. So today we're going to talk about type 1 diabetes. Last video we had talked about type 2 diabetes and it's been a wonderful discussion. And if you haven't watched the video, we recommend that you click on the button below and watch the video. Today will be based on type 1 diabetes. It is less common than type 2 diabetes, but it is also something that we need to talk about. About 5 to 10% of adult Americans and even young people have this disease. So I will be acting today as the audience, while Dr. Hope will be helping us to answer the basic questions that we may have. But if you have further questions, always put your questions down below and we will explain things to you as well. So, Dr. Hope, what exactly do we mean by type 1 diabetes?
Okay, so type 1 diabetes is actually an autoimmune destruction of the beta cells in the pancreas. So, just to kind of break that down, autoimmune is basically your own body is acting against your cells in the pancreas, which are the basic building blocks in the pancreas. The pancreas is the organ in your body that actually makes insulin. So your body is kind of acting against itself to destroy the cells in the pancreas that make insulin, and that results in a decreased amount of insulin in the body. And insulin is what is used, as we discussed earlier, to bring your blood sugar into the places that is needed in the body.
That's interesting. So does that mean that anyone can have this, or how do we is it specific to certain age group, or it also a disease for the adults?
Right. So type 1 diabetes is more commonly developed in younger people, younger individuals. It can even be diagnosed in very young children, even babies. And however, we found that it can also be identified or discovered at a later age, like in the teenage years or um, later on around that time, or even early adulthood, but mostly discovered in younger people and young children.
I see. So how is this different from type 2 diabetes that we discussed the last time?
Right. So the difference between type 1 and type 2 diabetes is, as I said, type 1 diabetes is a destruction of the cells that actually make insulin. So you end up having insulin deficiency. So your body cannot really make enough insulin to supply your needs. In type 2 diabetes, your body is usually making insulin, but it becomes insulin resistant. So although you may have insulin in the body, your body is not sensitive to that insulin. And later on, though, progressively, there is a decreased amount of insulin being produced as well. But initially, it starts out as an insulin resistance, whereas type 1 is more of an insulin deficiency.
So can someone be overweight? Because I know that we had discussed last time that if you are overweight, it's a big risk factor for you to have diabetes. Is that applicable as well for type 1 or not?
So, type 1 diabetes, obesity is not a risk factor. So patients develop type 1 from an autoimmune destruction of the cells, and it's thought that maybe viruses may play a role in that development, but it's not from obesity as compared to type 2 diabetes. However, can you have type 1 and be obese? Yes, you can, but it's not the risk factor that is causing you to develop type 1.
Thank you for that clarification. And so, what causes type 1 aside from the viruses? Can it be genetically related? Like, if any family member has that type 1 diabetes, does that mean that I can also have type 1 diabetes?
Right. So there's specific autoantibodies that are associated with the development of type 1 diabetes. And those autoantibodies may be found in other family members, but the genetic link is not as strong as it is in type 2 diabetes. However, if you develop those autoantibodies, or if those autoantibodies are identified and you have a family member who already has type 1, then there may be a higher risk of you developing type 1 diabetes as well. But it's usually identified by testing for autoantibodies.
Yeah, and I was reading from the CDC and NIH site that even though if you have type 1 diabetes, you may not develop the symptoms immediately. So you might not even be aware that you have that gene factors, or your body is already fighting you to have type 1. So it can actually happen for within months or years before you end up having the type 1 diabetes.
Right? It's more so once you develop it,
Mhm.
then the diabetes is not treated unless you get insulin. But the autoimmunity, right, can take a while to have a full effect. The autoimmune destruction of the pancreatic cells can take some time to
Yeah.
have a full effect. So in that way, yes, it can be progressive. But once those autoimmune cells uh, fully, have its effect and destroy the pancreatic beta cells,
Mhm.
then you need insulin in order to survive, really.
So, what are the symptoms that they should look out for or see to know that they are having type 1 diabetes?
Right. So the symptoms for type 1 diabetes is similar to the symptoms for type 2 diabetes. So it manifests as increased urination. So if you go into the bathroom often, more than usual, some people identify it, especially like in the middle of the night, if you find that you may have to go to the bathroom as opposed to not one or two times, but maybe three, four, 5 times a night, that may be a sign that you have type 1 diabetes or type 2. Blurry vision is another sign. And that means that your sugars are really high and that your body is not controlling the insulin in the blood. So blurry vision, increased urination, increased thirst. So if you're urinating a lot, you can become dehydrated and you become thirsty. And weight loss. So our body is made up of 66% of our body is made up of water, right? So when we lose a lot of water, our weight decreases. So weight loss is also one of the signs or symptoms of type 1 and type 2 diabetes. And even just feeling fatigue, feeling tired,
Mhm.
because of that, you're not getting the blood glucose to the places that it should be. You're losing weight, you're thirsty, you're urinating a lot. Then you can feel very tired as well. So those are other symptoms of type 1 diabetes.
Yeah, you mentioned it all. So if you have your symptoms, if you've started developing all these symptoms, or you've noticed any of these symptoms, go to the your primary care doctor, or any of your doctor that take care of you, and let them know the symptoms you're having, so they can test you out and confirm if you have diabetes or not. So what are the things that we do when the patient come in with all these symptoms? How do we test them, or what do we check for to see if it is type 1?
Okay, so first we want to identify whether they even have diabetes. So we do blood tests, and we could do finger sticks at first and immediately to see what their sugars are. and it's usually recorded as high. And then we also do blood tests to again evaluate the sugars, and also we check for acidosis in the blood test, because patients with type 1 are more likely to have something called ketoacidosis. And then we check for autoantibodies in order to differentiate. But we don't necessarily do that immediately, because when they come in, they need to be treated. The sugars need to be under control. We need to find out exactly what's going on. And then after some time, then we try to differentiate whether the patient has type 1 or type 2, and we check for autoantibodies. Some of those autoantibodies are called, one of them is GAD, it's glutamic acid decarboxylase. That's an antibody that actually stays around the longest. So if a person may have been diagnosed or may have developed diabetes earlier on, and then they've been treated for it, but maybe they never knew if they had type 1 or type 2, and they come to us maybe a couple years later, their GAD antibody could still be positive. So we would check for that. Other antibodies are islet cell antibodies that we use to identify type 1 diabetes specifically. So there are a few antibodies that are used to diagnose that type 1 diabetes and differentiate between type 1 and type 2 diabetes. So if the antibodies are positive, that the person likely has type 1 diabetes as opposed to type 2 diabetes.
Yeah. So the antibodies will really help us a lot, because the management, the treatment is different. Once we know that you have type 1, the way we manage and take care of you is different from the way we take care of people that have type 2. And what do we
That's
do? How do we
important.
treat them? Yeah, right? Yeah.
Right. Yeah, so type 1 diabetes can only be treated with insulin. They have an insulin deficiency and they need insulin. So there's an absolute need for insulin in type 1 diabetes. Patients with type 2 diabetes, initially, they may be treated with pills. There are certain pills, and initially metformin, unless there's a contraindication. That's usually the first pill that we use, but there are other newer agents that are used. So, agents like in the category of SGLT2 medications, GLP-1 medications. So things like Jardiance, Ozempic. So those are some of the medications that are used. DPP-4 medications, those are medications like Januvia. So those can be used in type 2 diabetes.
In type
But
2. Yeah.
in type 1 diabetes, you need insulin.
I see.
Type 2 diabetes, though, just to let you know, it can get to the point where you actually need insulin as
Insulin.
well. So, although type 1s definitely need insulin, patients with type 2s can be treated with pills, but if the diabetes worsens, they may need insulin as well.
So is type 1 curable?
So,
Or it
type
can only
1,
be
the
reversed?
right. So the only way that type 1 diabetes can be reversed right now is through a pancreatic transplant. So transplant of your pancreas from another human, or um, cells, the transfer of the pancreatic cells, the islet cells themselves. And that has been done. A pancreatic transplant and an islet cell transplant are modalities that are can be used to treat or to reverse type 1 diabetes, but it's rarely used, and there are decreased number of donors available. So this is not something that is done commonly. But those are the only known ways to reverse type 1 diabetes.
Yeah. And research are still ongoing to see,
Yes,
yeah, what can be done in the
definitely.
nearest future, how to, whether they will
Yes,
need pills without insulin
yes,
injection, or maybe there
yes,
are other ways to. So, but people who have been diagnosed of type 1 so far have been living pretty healthy life, as long as they take their insulin replacement, and
yeah.
people live their
Yeah, there's a
life.
lot of research going on for type 1 diabetes. You're right. And some some of the research does involve whether medications can be used to treat it. So, yes, there's a lot of really good ongoing research for type 1 diabetes.
Yeah.
So, that is important to know.
Yeah. So we'll be talking more about how you can manage your diabetes if you're on insulin, if you're on oral pills, because definitely once you have been told you have diabetes means you have to change many of your lifestyle, even if you have type 1 diabetes. Your diet also takes an important role, right?
Right. Yeah, so diet is the key, even with type 1. So both types, type 1 and type 2 diabetes, diet is important. If
Yeah.
you eat foods that are high in sugar or carbohydrates, which eventually turn into sugar,
Mm-hmm.
then it will lead to higher blood sugars. So the diet can actually be controlled, or if you control your diet well, then you can control your diabetes.
Mm. Okay. Yeah, so today, as you have heard about type 1 diabetes, it's very important that you control your diabetes with what you eat, you still do exercise, check your sugar because you are still prone to having low or high sugars, which we will talk about later in the our couple of videos. We're going to talk to you about how you can prevent low sugars and how to you can monitor your high sugars. And you can always lead a beautiful lifestyle even if you are diagnosed of type 1 or type 2 diabetes. So whatever it is, what you need to do is just stay with us if you and learn more on how you can better manage your health condition, and that is why we are here for you. So I think we will end it up here and move on from here next time to more about other types of diabetes. That is not type 1 or 2. There are other types, and we also need to know about it. Right.
Thank you for joining us.